Good afternoon, and welcome to another edition of Facebook Focus, live here at St. Mary's Hospital. My name is Hasnain Kermali. I'm the Chief Medical Officer. And each month we like to explore and demonstrate some of the new exciting features and clinical aspects that we're able to provide here at St. Mary's Hospital and to the community here in Waterbury, Connecticut. This month we're going to do something a little bit different. We're focusing on a special event that we're truly proud to be hosting coming up November 9th here in the Waterbury Market. It is an event titled Black Men in White Coats Youth Summit. This is going to be the first inaugural summit here in Connecticut, and we're truly proud to be hosting it on behalf of Trinity Health of New England here at St. Mary's Hospital. The event is meant to increase and focus on a large disparity, which is part of the educational disparity in medicine today. And so what we're looking to do is to inspire, network, and truly provide mentorship to young students across Connecticut, starting from grade 3 all the way up through colleges are the students we're looking to target during the Youth Summit, to really show them an opportunity and what medicine provides, but more so than just inspire that, show them mentors of theirs that have gone through the process as underrepresented minorities, Black men especially, who have had to go through the journey and their success and their story and working through that. So today, excited to welcome Dr. Frederick Comrie, a physical medicine and rehab specialist, part of our medical group here at Trinity Health of New England. Very familiar with Black Men in White Coats and their movement there. You attended a youth summit down in Dallas, Texas as well, and so with your 2 kids. So we're excited to bring them on board, and thank you so much for coming on and sitting with me for a couple of minutes from your busy day as well.
Thank you for having me.
So as we begin, like always, tell us a little bit about your journey into medicine, and then let's talk a little bit about this conversation about Black men in white coats.
Okay, thank you. So I grew up in Brooklyn, New York, and from there went into public school and had some specialized middle school and then later high school training, and there was not too many mentorship at that time for medicine for myself, but I was around like-minded individuals. Ended up going to Bronx High School of Science.
Gotcha.
With graduating, Nobel laureates, not myself at this time. Neil deGrasse Tyson is one of the famous alum.
Wow.
And astrophysicist.
Yeah.
And also other minority students were there who wanted to go on to higher degrees. My personal background, my folks are Jamaican, and my godfather had a doctorate. He went to Cornell to obtain this, and so I knew higher education was going to be important for me as well.
Sure.
And also, my stepmother is a physician over 40 years in Brooklyn, New York, and I was able to see how hectic obstetrics was, and still to this day. So after high school, then I went to Johns Hopkins University for a few years, and it was the same thing. Didn't really have much mentorship. The counselor, you just kind of stuck what classes you want on his door. He approved it. I was in biophysics major and trying to kind of navigate the way of pre-med at Johns Hopkins. Some made it, some didn't. Got the talking calculus, like look to your left, look to your right. That was the olden ways of saying not everyone's going to go on to medical school.
Yeah.
But stuck with it. Ended up coming back home, transferring to St. John's University, where I obtained my bachelor's in psychology. And it was the same thing, kind of navigate. They wanted me to go on into the PhD program, but I still had this yearning for medicine. One of the advisors said I wouldn't get into medical school, but I said, well, I went to Johns Hopkins. It was pretty tough, so we know how to navigate this. And so I did good on the test, the admission test to get into medical school, the MCATs, and a friend I stayed in touch with from Johns Hopkins was pursuing an MD PhD at Meharry Medical College, historically black college university that just does graduate students in Nashville, Tennessee. And so I went there, fell in love, got in after interviewing, and that's kind of when the mentorship really picked up.
Okay.
Had great anatomy professors, had almost immediate exposure to surgery, and also physiatry with interventional procedures. I still stay in touch with my physiatry mentor from Meharry to this day. And just like the black men and white coats, I found that there was always a need to bring up the next level of physicians in terms of black male physicians. And so I always would try to talk to undergraduates that I came across to push them and urge them to continue. It's hard to navigate that way. I then while in medical school, did some undergraduate research at Vanderbilt University Medical Center, and with their orthopedic trauma division, and just fell in love with musculoskeletal. And that's when I was first kind of exposed to regenerative medicine, recombinant bone morphogenic proteins to be exact, which I still remember. And I kind of pursue that now. I look into platelet-rich plasma injections for patients to help with pain, non-steroidal injections. But my focus is interventional pain and spine, as you know.
Yeah.
And all along this way, through this journey, when I was in medical school, when I was in residency, after residency, always trying to inspire students. In particular, my focus was kind of on the undergrad. I felt it was easier to talk to those, especially when they're on the cusp of making that major decision about going into medicine. And so I ended up in Dallas, Texas, and through association with the National Medical Association down there, the chapter, they had help with going to the Barak prep school on the south side of Dallas and bringing in the black men and white coats. And I thought it was a great idea. I brought my kids there. They were too young to participate at that time, which I think is great that we're capturing even younger audience down to the third grade. And I saw that it was truly inspirational to the youths that were coming in. Some were coming in from as far as Louisiana.
Yeah.
And definitely the local kids as well were inspired. And I hope that, some of them are still pursuing their medical careers up to this day.
So you touched on, in your own journey, the almost absence, except for your family, of a mentor, and the struggles that sort of you were having moving through. Is that something that is common within this pathway towards medicine, that particularly in your experience in the underrepresented minorities, that true mentorship is something that we're still missing?
Absolutely.
To help guide through not an easy path. I mean, the path to many postgraduate fields is not easy. But I mean, having gone through the medical one, I know that intimately, and so do you. It also is. We know its challenges. But do you find and do you believe we're still lacking in this area?
Yes, I think we are. I think that the numbers play a big role. We don't have a lot of underrepresented minority physicians, and thus we have this youth, whether middle school, junior high, high school, all look into a low number of or a small portion of the medical community to be inspired. Some, are lucky to have that association, but a lot don't see it and they can't picture themselves in that role. I recall my pediatrician growing up was a black physician. And then when I was in college, you just kind of getting signed off for general health, and I did have some of color, but not black at that time. And then in my postgraduate, then I did have another black male physician, and was telling them that I too wanted to become a doctor, and he said, stick with it. So very busy doctor, almost, worked himself and didn't take care of himself, but has since passed. But just having that person to say, yeah, keep doing it, pursue this, you can do it. It's a lot of hard work, and then just sticking with it. I think that's the kind of key to achieving the goal of getting into the one MD coach out of University of Virginia, called it the MD Promised Land. Dr. Henry Moses, I remember him, or Dr. Moses. Henry Moses was also at Meharry Medical College. Okay. So after pursuing my baccalaureate, then went to do additional training to get into medical school, and this was one of the opportunities where I was able to take additional training for preparing for the admission tests, along with being exposed with black physicians at University of Virginia, along with following and doing shadowing in the emergency room as well.
Yeah. So, I mean, clearly having the mentorship, and you talked about even right now, well, you finished your baccalaureate degree, but then it wasn't a direct to medical school. Like, you took a step in between to focus in on the medical college admission test, the MCAT, and then pursuing some other programs to help you get ready to get into medical school. Those are steps that not everyone has to take, but part of that process allows us to have that exposure. One of the things that I believe that's important is sparking that interest at an early age. Like so when did you feel, hey, I want to become a doctor? Like, do you remember as a child being like, hey, this is something I want to do because your stepmom or somebody else was like, this is interesting?
No, it was later on, because I didn't have a lot of exposure as a child, and then when I got to high school, then it was okay. This is a specialized high school. People go on to Ivy Leagues, and
at the Brooklyn High School of Science.
Well, no, the Bronx High School of
Science.
Yeah. We have rivalries with the high schools out there, and so we talked about it amongst ourselves.
Gotcha.
And that's kind of when it was more an option. So I was either going to pursue medical scientist training or regular scientist training, i.e. PhD, or pursue an MD. And then selecting Johns Hopkins kind of nailed it down.
Gotcha.
A lot of people were more focused on pre-medicine at that time, so we had a lot of students like that look like myself, one of the largest African American classes that they've had. There's some issues going on there with that right now.
Yeah.
And driving each other, telling everybody like, okay, this is what you need to do. And then other students that were just pre-med. One of my friend's roommate had it navigated down what he wanted to do all 4 years and how he was planning to take the MCATs his junior year and go on to medical school. So that was part of learning the process. And I tell college students now, some of them try to kind of gear off onto extending their post-baccalaureate into different areas, and I say but really focus on trying to get the prerequisites in, then doing the MCAT, and then going on directly into medicine if that's what you really want.
Right.
If you don't know, then that's fine. There's time to navigate, doing the master's training, and seeing if that's the route you want to do to go on to your PhD.
Yeah. And so let's talk about the event down in Dallas. Tell us a little bit about what you experienced down there with that event. And then we can start talking about what we're planning for over here.
Okay, so I think it was similar, not on the scale that you have here necessarily, done inside a high school with local black physicians, along with the director of the program coming into school on the south side, mainly for African American males, and inviting the community to come in, talking about people's journeys into medicine and how to inspire or be inspired by these talks that they were having, and then also going into stations that were fun activities for the kids, teaching them about anatomy, teaching them about medicine. There was one that was a race to see who could put on the surgical scrubs the fastest, and I definitely like that. I bring home stuff from my daughter to get dressed in, or my son, just to continue inspiring them to maybe think about and or pursue a career in medicine as well.
So that's amazing. Having spoken with what we refer to on the organizational scale for Black Men and White Coat Youth Summits, they have a mastermind group where we sit down and we talk about different ideas that we're coming forward. And the ideas about what happened down there from that event, from some of the other national events, really have inspired in what we're doing. So, we're bringing, I think our registration is closing in on 1,000 participants to come down here, which is exciting. Having those same hands-on type sessions with the kids to show them and demonstrate some of the cool aspects that they're going to be able to get into, and we're excited about that. And having larger exhibits where they're going to participate with the Da Vinci robot, for example.
Right.
I think we've got a virtual training with or a virtual reality medical training exhibit too. So we've got a couple of really cool things, but I mean, your perspective on igniting that spark at an early age, how critical is that for some of our children, along with then for our older kids, giving them the pathway, and then finally for the parents who are helping to guide and navigate some of these other pieces, because we're going to have information for parents,
as well,
talks on them, sort of giving them an idea of how are they going to navigate some of the challenges, particularly when it comes to just getting into undergrad. Before even going to medical school, the financial challenges in today's world of undergraduate education. So, we're excited because it's going to be a fun hands-on event. But, are we in the right track that we're sparking this at such a young age?
Oh, absolutely. A lot of people that I went to medical school with had that story of being young and inspired, and I knew that I wanted to be a doctor when I was young, and and that's what I'm trying to express with my own children as well, is that there is a spot for you at the table. There, you can pursue any pathway, any career in the medical field, and that we want to have the children see it. We want them to continue to work towards it through high school and into college, and we definitely want to help the parents feel comfortable with that journey, not worrying about the cost of education, how to navigate getting loans versus scholarships to get into undergraduate, and then on to the next level for medical school training. There's schools that are getting endowed and fully funded that students don't have to pay anything. I wish I was around when I was in medical training. And
there's a whole discussion. There's actually a recent article about how good is that, particularly when we think about primary care. But that's a different topic for a different day.
Awesome. And I've been pushing it locally as well. I don't know if you talked to Dr. Hurley, but she knows that she's trained you, and so I brought it up at the local National Medical Association chapter meeting here a few months ago, and there's been great support. I know that they're coming as well. And I also try to reach out to Meharry Medical College to try to get the National Alumni Association involved, in the sense that it was supposed to be maybe a blast going out to the Northeast about this, and wanted to see it grow, and then just reaching out to local networks as well.
Yeah, and I mean, to me, that's part of the beauty of this, that so many of us are so connected, and want to have a program like this continue to develop and blossom, and we're all connecting in different spheres that we live in. I get emails from people. We were talking about it on the news as well, and so there's been a lot of outreach from the community to say, hey, this is a great opportunity. How can we be involved? I think we're up close to 150, 160 volunteers. So we're going to have a packed house, not only of participants, but people who are going to be involved in the program. And we're excited. I mean, Saturday, November 9th, here in Waterbury, 8 a.m. is the registration. So we're excited. Dr. Dale Okordudu, who's the founder of Black Men in White Coats, he's going to be here offering the keynote address. We've got the DJ who's going to be present. He's going to be doing a great job. So it's going to be a fun event. Thankfully, with a number of our sponsors, we were able to host this event completely free for the community. So we're excited about that. Breakfast and lunch being included. So we're truly blessed to have been the inaugural site here, and we're looking to continue this program as we move forward. Would love to hear your thoughts, last pearls of wisdom for the team before we wrap it up here.
I think the pearl that I want to stress is giving back. I feel that the reaching back to pull up those behind us is key.
Yeah.
And currently, I feel that I'm working with one of the UConn undergraduates who is at that cusp. Do I go on to pursue my PhD, or do I want to do an MD? And trying to inspire to do the research and do what it takes to get to that next level. So I'm always trying to make myself available for especially the undergraduate and when they go on to medical school as well.
Yeah.
And so I can continue to say, okay, now the next step, residency,
right. Exactly.
and further training. So I can definitely appreciate the mentors that I've had along the way, and the special story that has brought me here to be in Connecticut as well.
Well, we're excited, and thank you all for listening in. Again, www.trinityhealthofne.org/BMWC. That's going to get you to our landing page. Registration is right there at the top. We're definitely looking for continued volunteers and mentors. Like Dr. Comrie was mentioning, it's time to reach back and continue to pull up, inspire our younger generation to a pathway of medicine, which I think has been great for me. It's been great for you, and I think our interactions with patients. But a lot of fun for me is interacting with the next generation coming forward, and that's what we're looking to do here. So look forward to seeing you all there, and look forward to making this future reality here in Connecticut. Thank you all for joining us, and thank you very much, Dr. Comrie.
Thank you for having me.
Have a great day.